whenever we're giving patients drugs or foreign chemicals or compounds, there's always a risk for allergic reactions. Could you tell us a little bit more about that?
Sure. Whenever anyone's receiving a new drug, there's always the potential for an allergic reaction, whether it's an antibiotic pill that may be given to you, or the actual chemotherapy infusion, or some of the pre-medications that we use, like Benadryl and other medications. Generally, you're being watched very well when you're receiving your IV medication, and we ask patients to let us know if they're uncomfortable, if they have any trouble breathing, if they feel lightheaded, or they feel hot all of a sudden. But they're being watched very carefully by an infusion nurse.
Are there some times when we can give patients medications prior to the infusion to help decrease that risk?
Mm-hmm. We do. There are certain medications that have, I guess, a higher potential for an allergic reaction. So we pre-med according to the physician recommendations for those chemotherapies. We give medications like Tylenol and Benadryl, and sometimes some other medications like Zantac through the IV to help decrease the risk of a reaction.
Sometimes even low-dose steroids, I assume, can be used either before the infusion or afterwards by mouth.
There are some medications that we actually have the patient start steroids at home before they come in, and that helps decrease potential reaction. So we watch folks closely and are looking for any, especially the very first infusion, any possible allergic reaction.
And usually that occurs fairly quickly after you've received the drug, allergic reactions to chemotherapy, for example. Is that true?
That's true. Usually within the first few minutes, if someone is going to have allergic reaction, it happens in the first few minutes. And with other medications, there are times that we keep folks for an observation period just to watch them for 30 minutes or an hour to just make sure that they're not having any problems with those medications they just received.
Okay.